Hey everybody. So here is a video lecture on Adlerian theory, reality and choice theory, and person-centered theory. We're gonna try to do all three. Um, so let's start with Adlerian. Adlerian, out of these, the name theories is probably the oldest. I think that timeline-wise, it would probably be Adlerian, then person-centered, then reality choice theory is newer. But so let's start with Adlerian because that's the way the book chapters work. Adlerian is meant to be short term, and I think maybe the way to start this is to say that Alfred Adler's approach was a shift therapeutically from what we saw with, say, like your Sigmund Freud, psychoanalytic approach, where everything was focused on the individual, was focused on like past life regression, dream work, things of that sort. Adler's was the first therapeutic orientation that actually looks like modern therapy or modern counseling. Adler believed in sort of a whole person viewpoint. Um, it was meant to be short term, whereas previous uh, counseling orientations, again, psychoanalysis and so forth, were meant to be possibly lifelong. It This was meant to kind of deal with problems and then allow the person to move on. It is goal oriented, holistic, so on and so forth. The main aspect of Adler's approach was to deal with inferiority complexes. Alfred Adler believed that people were not just a product of their own individual minds, but were social creatures. And so interactions between um, the um, the client and their family, the client and their friends, the client and their coworkers resulted in belief systems that got created around the person. The person created these belief systems, and so their feelings of inferiority were meant to kind of keep them stuck. So um, if we worked on all of these areas, we were also then focusing on a sense of belonging. Birth order came into Alfred Adler's theory. Some cognitive distortions and belief systems around thought came into Adler's theory. He proposed a four-phase model to therapy. So the idea that there is an engagement phase, and this is where we build that trusting relationship. So this is the first we're hearing about that. The assessment phase, so we get to know what the client is thinking, feeling, etc. Um, he also identified that this is where their basic mistakes were. So in the assessment phase, we were assessing for those cognitive distortions, the belief systems that were untrue. We worked so engagement, assessment, insight, helping the client to understand their motivations better, why they do the things they do and behave the ways that they behave. Um, I'll have a sidebar on that in just a moment because I think it's an important distinction. And then reorientation. So that's the part where we actually get them to think and behave differently, often through action and homework and things of that sort. So Adler believed that a lot of what we did was based on this idea of an inferiority complex, and so that it took our unhealthy belief systems and turned them into kind of useless behaviors. One of the things that I remember from Adler was this was the first time I heard someone say that we are most well when we are being truthful to ourselves, and we are most sick when we are lying to ourselves. It certainly got applied later on in other theories as well, but this was the first that I saw that or heard about that. And so some of the techniques that you see are the acting as if intervention, which is one of my favorites. This is where you get the client to try to behave in a way that a person who did not have the symptoms that they have behaved. So, like, I used to work when I was working in substance abuse counseling, this acting as if was a particularly useful or intervention. I couldn't write about it though because my substance abuse counseling practice required us write in CBT terminology, and this is Adlerian. But that's a conversation for another time with note taking and documentation. But acting as if was okay, so yes, you are a person who's been struggling with substance use your entire life. What are the things that a person who is not struggling with substance use might do? Do those. They're not going to feel normal. That's okay. Push through it. Do it even though it doesn't feel normal. And then let's assess what happens on the other side of this. And it can happen with less tangible things as substance use. If somebody is struggling with confidence in themselves, they can act like a person who is confident in themselves. If somebody wants to become something with their life, you know find a certain job or career direction or something, or pursue um, a move or something like that, but they're afraid of XYZ, they should act like a person who is not afraid of those things. Um, so catching oneself is another one of the orientation, or another one of the interventions. I keep wanting to say orientation instead of intervention. This is where you help a person become sort of aware of their self-defeating belief systems. And so that's where you would really interrupt them in session as they're talking about something, and you notice that they are getting down on themselves about something, pointing it out. And so that's catching oneself, and then kind of having a confrontation and a discussion about that. Spitting in the soup is another one of the interventions. The idea is that once you help them to see the motivation in their behavior, they're going to be less likely to want to do it in the future because they're going to know something more about it now. And that's actually where my segue comes in. I had a conversation with a friend once about human behavior, and I kept saying that, and I realized it was a belief of mine, that all of our behaviors mean something. That if it didn't mean something, we wouldn't do it. And he told me that he disagreed with that. And he had no alternative argument for that. He just said that, sometimes people are just one way or another. We don't always have any sort of thought into our behaviors. And I disagree. I think that our behaviors all serve a purpose, or we would be behaving differently. We wouldn't get ourselves stuck. So um, it's not always apparent, but it is, I do believe, the case that our behaviors serve a purpose and that they keep us stuck, and if this it's associated with our belief systems about ourselves. So that all came from Adler. Um, we'll skip ahead and do the reality choice theory because that's how the chapters are grouped. But this is a newer theory. It was created by William Glasser, Dr. William Glasser in the 60s. Dr. Glasser was a psychiatrist, actually. And so he realized at some point that the medications that he was prescribing people weren't ending up getting them into any better place in their life. And so I don't agree with throwing the baby out with the bathwater on this, but he decided that psychiatric medication was not going to be helpful, and so shifted into this reality therapy orientation that he found to be helpful. Now, I think it's also important to know that William Glasser worked for a residential treatment facility. I believe it was a female residential treatment facility. Not that that matters, but just for the sake of the discussion, the residential treatment facility piece does matter. Um, and so what he learned there was people would get in their own way. And so he developed this theory that we could focus on the here and now, doesn't matter about the past again, but that a person needs to kind of take responsibility for their choices in the moment. And then that would improve their current dynamics. So one of his big questions was, I think I mentioned that I really like certain questions associated with different theorists. Like Fritz Perls' question is, "Who told you that?" Um, William Glasser's question is, "How's that working for you?" So, you would ask a client, what is it that they want to accomplish in their life, where they want to be. And you'd ask them then about what they're doing now. And it would be an opportunity to kind of show them that their behaviors are not getting them what it is that they want. So, how's that working for you? The reality and choice theory has sort of evolved a little bit. It got picked up by a bunch of different theorists, but Dr. Robert Wubbelding is one of the newer theorists that has sort of dabbled with this approach, and he came up with the what is pronounced WEDEP model. It's just an acronym, WDEP, but they pronounce it WEDEP or would up. I don't know. Anyway, it stands for wants, doing and direction, evaluation, and planning. So the process here is when you look at wants, you're exploring what the client wants from their life. When you're doing the doing and direction, it's examining how their current behaviors are getting them what they want or not, is actually the truth. Evaluation, so is it helping or hindering them? And then plan, figure out the better way to approach this stuff. Reality choice theory works with a lot of different populations. I used it a lot in family based counseling. I used it a lot in substance abuse counseling, but it's applicable kind of across the board. Very direct, doesn't mean it's argumentative, just direct. Gets used heavily in residential facilities, whether that whether the people in the facilities know that they're doing utilizing a theoretical orientation or not. That is the case. So yeah, I think it is very applicable. One other thing that they focused on was drives, the reasons why we do stuff the way we do. And so Glasser believed that there were five drives: survival, which is physical safety, food, shelter, things like that. Love and belonging was the second, connection, relationships. Power, which had to do with self worth and personal achievement. Freedom, so the ability to be independent and autonomous to make choices for yourself. And then fun. So we do things based on survival, love and belonging, power, freedom, or fun. And so knowing some of that, knowing what the drive is, can help us to make sense of the behaviors, can help us see if it's actually accomplishing what the person wants, can shift them into different sorts of theories or approaches. Again, it was confrontational as a style. It is confrontational as a style, but they use a lot of humor in reality choice theory to kind of point out the mismatch that's going on in a person's life. So the last approach we'll talk about is person-centered therapy. This was primarily developed by Carl Rogers. In fact, if you were to like Google person-centered therapy and select images, you would get a flood of images of Carl Rogers. Um, the theory was revolutionary at the time. The idea that radical acceptance of a client is really all we needed in order to help that client to be better. So basically, if the client knew we cared about them and we presented with what Rogers termed unconditional positive regard, which is unconditional positive regard is this idea that we are completely non-judgmental, accept a client for exactly who they are. All of their failings and faults are not actually failings and faults. They are just them. We accept them, we empathize with them, we care about them. And so you can apply any other theoretical approach, and I would suggest that you're always applying unconditional positive regard, even if you don't exclusively align with being a person-centered therapist. Um, it's just really in line with our entire orientation. Rogers applied a very non-directional approach. He believed that the client had everything that they needed in order to make the change that they needed to have in their life. That we were simply there as kind of a sounding board and a reflecting board for them. Um, we would provide the unconditional positive regard and they would navigate the process through our support. Um, it doesn't have a lot of interventions as a theory. More so just the role of the client as being the sounding board for them is kind of critically central to the approach. As a result, it gets kind of difficult to do person-centered theory and do it well in, say, an advanced skills class or something like that, where you're being asked to use some skills because there are not specific interventions so much as just being um, unconditional positive regard, showing that, being congruent. So you are real, transparent, and authentic to your client. Um, we want to point out their inner conflict and their lack of congruence. Rogers did have an intervention where he talked about the real self and the ideal self. And so it was the real versus the ideal self, where we would look at So like me as a real person, let's say I wanted to, the example I always get to that is most tangible is, let's say I want to lose weight. I have a couple choices. So the real me is in my, um, in my 40s and has been doing, I have my genetics, I have my, my particular lifestyle, I have children. And so the real me has a very hard time eating well and exercising. Yes, there are excuses in there, but also there is reality. I'm not in my 20s. I don't bounce back from things the way I used to. And then there's the ideal me, which is the me in my 20s. And so the real versus ideal self is that I have to um, make some decisions. Either I can pull the real self closer to the ideal, which would be not making any excuses, getting out there and exercising, eating better, making, better sleep choices, things like that. Or I can realize I am not in my 20s anymore. I have certain physical limitations that come with, having been in a car accident. I'm predisposed to certain things, all the stuff that happens. And so, in that case, just being more aware of those things moves the ideal closer to the real. Now, the reality is one of the best interventions is to move them both together to kind of a central point. But I think breaking it down to those specific directions helps to break down some of that incongruence. Um, and so that is Roger's approach. That is person-centered theory. I mentioned about how reality and choice theory is applicable kind of in a range of different practice areas. Person-centered theory is the one that most people go to whenever they are in a theories class. They seem to align most with this, and I think it makes sense because the belief system is really perfectly in line with who we are as professionals or who we want to be as professionals. The catch is it gets really hard to demonstrate in certain areas of the field. Like when I was in family-based counseling, a lot of my clients were not particularly motivated, whether it be the kids or the parents. And so, since they lacked that sort of motivation, they lacked an ability to self-reflect as a result. Because I'd ask them what they saw as going wrong with their life, and it was everybody else doing this to them. And yeah, that is the case, but their choices still paint the picture of their lives. Their choices are still central to um, their own change process or lack thereof. And they had a very hard time seeing those connections. So, in order for me to just kind of sit back and say, why? Well, they didn't have any of the answers. They do. Truthfully, they do. But they weren't making those connections on their own. So, they needed me to be a much more central part of that process. So, reality and choice theory is much more central. Person centered, the counselor is not the expert. Our role is to be separate of all of this and to just be there to support the client. Certainly, we direct, but it's different. So those are the three different approaches: Adlerian, reality choice theory, and person centered. And yeah, I'll look forward to sharing some more of these theories soon.